My name is Dr. AJ Julka. I'm a hand, wrist, and elbow specialist here at JIS Orthopedics. I am originally from Strongsville, so it's a suburb of western Cleveland. And prior to that, my dad was in the military, my mom was a teacher, so we lived all over, just moving around in the military, but we settled down in Cleveland, Ohio. So I've been to school all over. I started my undergraduate studies at University of Wisconsin, then I did medical school at Ohio State University. After that, I was lucky enough to get into an orthopedic residency at University of Michigan Hospitals, and then I did an extra year of upper extremity, hand, wrist, elbow surgery fellowship at Cleveland Clinic. I had a bit of a different path towards becoming a physician. Initially, I wasn't really interested in medicine. My brother had done medicine, and I was more interested in engineering, business, chemistry, and I really explored all those facets in undergraduate studies. And there was a time, it was probably about my first or second year, that I got to go in just off chance. We had a friend of the family that was a neurosurgeon. I got to go watch a surgery, and that was pretty much it. I was inspired by seeing the surgery. I wanted to be part of it. I just wanted to learn everything I could about it. And that inspiration stays with me today. So I've been practicing medicine after fellowship for 8 years. I've been doing hand, wrist, elbow surgery during that entire 8 years. And all 8 years that I've been working, I've been primarily doing the most complex hand, wrist, elbow surgery. So I've been at 2 level 1 trauma centers, one University of Wisconsin, followed by Ohio State University, and now I'm here at JIS Orthopedics. I think my favorite part about being a surgeon is really connecting with patients, learning from them, so understanding their lives, all these little things that they bring to me and how they enrich my life, and then really refining surgical technique over time to make it better and better, and then seeing that in the patients that you actually treat, watching them come back and seeing that your version of surgery now, after 8 years, after 5,000 operations, it's markedly better than what you could have done 4 or 5 years ago. The way that we run our practice in the hand division and our clinic is it's extremely personalized. So you are not a number in the practice. You are an individual patient. You're treated like that. We get to know you. Our staff gets to know you. If you have any questions, concerns, you call the one staff member that I work with on a day in, day out basis, or you call me personally. That's how I like people treated. That's the way that it's most enjoyable to me. At the same time, when you have your surgery, you're treated like a person as well. Typically, I close every single patient's wounds. I put on their dressing. I see them post-operatively. I take off their suture. So it's very hands-on. It is very personalized. And patients really respond to it well. They feel like the medical care is being tailored to them versus they're just another number. My goal is to, number one, I start with the clinic. Not every person needs surgery. The first goal of the clinic is to educate that patient. So when they come in, they deserve our attention. They deserve to get an accurate diagnosis and deserve all the education behind what their condition looks like now. What is it going to look like in 5 years? And then when I'm a grandmother, grandfather, what are my hands, wrists? What is that going to look like, and what do I expect? So they deserve all that education. So the first part of what we do in our clinic is educate patients. After we diagnose them, educate them to the best of our ability so they really know what is going on, and then allow them to make a decision about their care.